Hi, it's Dr. Mache, and welcome to Ask Dr. Mache. And this month is a very big one in women's health. First of all, it is National Menopause Awareness Month, and the second is that it is National Hereditary Breast and Ovarian Cancer Awareness Month. And so I thought it would be good to talk today about a topic that I think gets too little discussion, and that is the inherited potential risk of breast cancer. So I really want to focus in on that with you for a few minutes and spend some time so you have a better understanding of your risk, what you should do, what does it mean, and some related things that will help you live better, healthier, happier, and longer. Now, the first thing is, what causes this breast cancer risk? Why are some women more likely to get it? For instance, the typical woman has a general lifespan risk of breast cancer about 1 in 8, or about 12%. So before she's 70 or so that she will get breast cancer, she has about a 12% risk in general. But women who have certain genes for breast cancer can be at a risk that can increase that 12% lifetime risk to as high as 75 or 80%, and anywhere in between. So just because you have the genes doesn't mean you'll get breast cancer, but having the genes means that you will be more likely to, you're at greater risk, and so there are things you need to think about in order to lower that chance, and that's what I want to talk about. First of all, what are those genes? Now, most people are familiar, I'm not going to say most, but many people are familiar with the BRCA. That's the breast cancer, or BRCA gene. Now, this is probably the most common of the breast cancer gene, but let me just say, like many of these genetic changes, it doesn't mean you're going to get breast cancer, but more likely have a greater risk. So, and it doesn't only mean that you're at increased risk for breast cancer, depending if it's BRCA1 or 2. BRCA1 or 2, you may be at more risk for ovarian cancer as well, and also an increased risk of certain other cancers, such as melanoma, or skin cancer, and colon cancer and pancreatic cancer. All of these things can be at increased risk. So it has a huge impact. It also has an impact because when you have your children, you have a slight increased risk, a 50% chance for the most part, that your kids could get that particular gene from you. So if that is the case, then your children will also have these increased risks. So it has impact. And the fact that it can be passed down from generation to generation, of course, is why there's a family history. So which are the genes? Well, there's the BRCA, but there's a bunch more of them. They have names like ATM. Sounds like a cash machine, but it isn't. It's a gene defect. BIRIP1. CDH1, CHEK2, that's CHECK2, PALB-B, PALB2, and there are several more that I won't read right now. But the reason I'm mentioning is not just one thing. So if you have a strong family history and you are get tested for the BRCA gene and it's positive, well, that tells you that that's associated, but just because one isn't associated, there could be others. So let me just mention about what are some of the things that you should know that could put you at increased risk. Who should be tested? Everybody doesn't have to be tested for these genes, but some people should. One, somebody who has a family history of course, breast or ovarian cancer, a strong family history. That would be one of the things. A second might be a relative who has triple negative breast cancer. That would be another one. Other cancers in the family like prostate cancer, melanoma, pancreatic cancer, stomach cancer, thyroid or uterine cancer or colon cancer, if you have a family history of those, that would be a person who perhaps should be tested. A woman who has had breast cancer in both breasts, she or her family are more likely to have an inherited gene. An Ashkenazi Jewish woman who is at more risk, would be at more risk, and an African American woman who is diagnosed with breast cancer before or at age 35. Now, those are all increased risk factors. Also, if you have a male in the family who had breast cancer, and I know it sounds weird, but about 3% of men will have breast cancer. And finally, if you have a known abnormal breast cancer gene, any of these in your family. Now, just because your mother or your father has this gene doesn't mean you'll get it. It's not 100% that you're going to get the gene, but it's 50% or so, depending on which of these genes it is. So all of these things are important. And they are important because if you have a heads up, there are measures that you can do to lower the risk of getting breast cancer. And of course, that's what we want to do, is lower our risk as much as possible. Now, for prevention, of course, one of the things that's important is to keep your weight at a good level. In other words, not be over or underweight. So maintaining a healthy weight is one thing that you can do. The second thing is don't smoke. It's bad. It's bad for your general health, but it's also increasing your risk of breast cancer. So don't smoke. If you smoke, stop smoking. The next thing is to eat nutritionally healthy foods. And you want to stay away from a lot of the saturated fats, the trans fats, and heavy in the proteins, and maintaining a healthy nutrition with as much vegetarian part of your diet as you can. You want to limit alcohol. So if you're a woman, more than a glass of wine a day is considered more than the optimal amount in terms of your risk here and in general for women. For men, it's 2 drinks a day. That may seem like a lot or a little depending on who you are. I know that some people really do a lot. What's a healthy weight for someone that's 5'2"? Well, of course, it depends a little on your bone size and so forth, but at 5'2", you want to be somewhere around, say, 110, 115 pounds, maybe 120 pounds, depending on your build. And certainly within 10 or 15% of that starts to put you into overweight or underweight, depending on which side of it is. So generally for women, a kind of rule of thumb is about 100 pounds for the first 5 feet, and then about 5 or 6 pounds for each inch after that. That's just a rule of thumb. So maintain a healthy diet. And then one that's really important is exercise. Regular exercise, getting out there and being active, lowers your risk of breast cancer. It also improves depression, lowers your risk of heart disease. Wow, Mom was right. Exercise is good for you. So all those things, limiting alcohol, exercise regularly, maintaining a healthy diet, eating healthy, and not smoking. 5 things that you can do to lower your risk of breast disease. And that's true whether or not you have genetic diseases. Now, one of the things that's important in knowing this is if you have a genetic predisposition, for many people, like the most common one, the breast cancer gene, many times they'll be asked by their doctor or suggested to remove their ovaries and their fallopian tubes sometime around age 35 or 38 or certainly by age 40 for most women in order to lower the risk of breast and ovarian cancer, because some of them, like the BRCA, increases the risk of breast cancer. And how it works is that these genes that are now abnormal, they're mutated, have an abnormal portion. These genes often are involved in protection against cancer, and so when they are not working perfectly as they could, then the risk of cancer goes up. So you want to realize that you may be asked, in order to lower your risk of cancer, to have your ovaries removed. Now, what does that mean? Well, that means you're going to go into menopause. And if you are someone who has delayed having kids, then you may need to consider having eggs frozen if you're single, or embryos frozen, doing in vitro fertilization if you have a partner. And in that case, there's a lot, that's a whole discussion I could talk about, but just remember there's a reproductive side over here, and then there's the menopause side over there. And in fact, I talk a lot about this in my new book called The Estrogen Fix, which explains a lot of this and explains about hormone therapy. And a lot of women are under the misguided idea, their doctors too, think, for instance, if they have the BRCA gene, the breast cancer gene, and they go and have surgery to have their ovaries out, well, that means they can't have estrogen, right? Well, no, it's not necessarily right. And I explained that in the book. In fact, even though your ovaries are removed and your tubes are out, you can still, in most instances, for that, go on hormone therapy, which makes a big difference in the quality of your life. You can actually get the book, and I have made some special bonus gifts available for you at estrogenfixbook.com. What it does is it will route you through to my website, where you can pick up 9 bonus gifts as a thank you, but to encourage you to get this book and spread the word, because women need this information. If you don't know, when you go to your doctor, sometimes the doctors are not aware of this latest information, and this has a huge impact on the quality of your life after you go through treatment in order to prevent cancer. So you want to know exactly what you can and can't do in order to have good quality of life. So in any event, I wanted to acknowledge that it's breast cancer, Hereditary Breast Cancer Awareness Week. It is National Menopause Awareness Month, and I wanted to make some of these points available to you because as a woman, we know that so many women are worried about breast cancer. It's a scary disease. And of course, there are pink ribbons, there are marches, there are so many things. But because breasts are so integral to a woman's self-esteem and the way she might feel about herself, protecting breasts becomes not only a health and a life measure, but it's also a measure of how you feel about yourself, what you look like in the mirror. And many times, breasts don't have to be removed anymore. Many times it can just be a lump. If it is a breast cancer, there's many times just a lump can be removed and the breast can be preserved. And in those instances where the breasts do have to have surgery and do have to be removed, there are many cosmetic things that can be done to make you look and feel good about yourself, which is really essential. So I'm happy to address questions if you have any. I wanted to share this information with you because I feel it's very important, and also to honor the Hereditary Breast Cancer Awareness Month. I know I've spoken recently at the Force meeting. It was down in Florida this past year, a few months ago, and in there we're talking about facing our risks of cancer. Empowered is what the acronym FORCE stands for. I spoke to about 500 women there, talking about the treatment, what to do about breast cancer prevention, and what to do if you either have the gene, what the next steps are, or what you can do if you have your ovaries removed. This is important information. I was impressed with the fact that women stood in line I stood there for about an hour after my talk answering questions from women from the audience, because they were so hungry for this information. It's really important for you to know, get what you need for information, and be empowered so that you can be a partner in your health care. I mentioned one more time that my book just came out September the 19th. It's called The Estrogen Fix, and it is the breakthrough guide to being healthy, energized, and hormonally balanced. And it's important for all women but particularly women who might be thrown into early menopause or a history of breast cancer, because there are things that you can be doing to stay feminine, to feel good, and still not compromise in any way your breast cancer risk. And again, you can get that at estrogenfixbook.com. If you have any questions, you can write them down. I do check back in the next day or so. I'll go back and check this Facebook Live and see if people have had comments or things they'd like to do, have addressed, and maybe weren't able to get on live. And I want to ask, if you would, to please share this with people, to please follow me, and to please share this so that others can get it as well. And also I want to tell you that every Thursday at 9 p.m. Eastern, I have a regular weekly Facebook Live that I do. It's Ask Dr. Mache. It's at My Menopause Magazine. And I do it every Thursday, 9 p.m. Eastern. I hope you'll join me. Please tell your friends. Please share this in the Facebook Live with your friends, and please follow. And I look forward to see you at other Facebook Lives. In the meantime, stay well.